So, hi Talia, thank you for being on my channel today. And we are going to talk about fluoroquinolone and fluoroquinolone toxicity awareness day that is coming very soon. It's on the 22nd of October, if I'm not mistaken.
Mhm.
And we are going to be listening to you today, explaining what are fluoroquinolones. And then we move on to what's new with fluoroquinolones because an important thing happened. So without further ado, we listen to you.
Well, thanks for having me again.
Yeah,
It's nice
yeah,
to see
it's a
you.
pleasure.
Yeah. So, to everybody watching, I'll start with what a fluoroquinolone is because that's a mouthful, mouthful to say. It's very difficult. So, fluoroquinolone antibiotics are a class of antibiotics with many different types within that. So, for example, a fluoroquinolone antibiotic is ciprofloxacin, levofloxacin, Avelox, et cetera, et cetera. There's a lot of them, but it is a class of synthetic broad-spectrum antibiotics that are commonly used for UTIs, which they shouldn't be, and complex infections like pneumonia and even anthrax. That's crazy to me. But fluoroquinolones cause fluoroquinolone toxicity, which is also known as being floxed. And people are like, what is that? So that is also known as being floxed, and that just means that a person is suffering from the adverse effects of a fluoroquinolone antibiotic. So it's all kind of the same thing when people say fluoroquinolone toxicity, floxed, all of that. You can develop fluoroquinolone toxicity from all forms of the antibiotic, that is pill form, IV form, injectable, eye drops, and eardrops. So for people out there that think the eardrops and eye drops don't go inside, that's incorrect. You can definitely be impacted by eardrops and eye drops. The other thing that I like to know about fluoroquinolone antibiotics is that there are 7 black box warnings, and that is for a reason. In the United States, that's the strictest warning that the FDA can give on a drug. And the fact that there's 7 says something, right? So the most damaging black box warning is that it says it causes permanent and disabling side effects of the central nervous system, joints, muscles, tendons. It goes on and on and on. So I think many people don't understand that when they go and take this class of antibiotics. The other thing to note is in the same year, this is in 2016, so these warnings have been out for a long time. So in my mind, there's no excuse for any doctor or any prescriber to not know that this exists. The other part of the warning is that fluoroquinolone antibiotics should be used as last resort when no other treatment options are available. That is key. So a lot of times when you go to the doctor is just used to prescribing a broad spectrum antibiotic because typically it's going to hit on pretty much any bacteria. So they like to give that so it'll fix you and you don't have to come back. But that's not necessarily the right thing to do. So for anybody that's watching this, if you are prescribed a fluoroquinolone antibiotic, please ask for an alternative. The message is never to tell you that you should not take medication that you need. The message is that if you are prescribed a fluoroquinolone antibiotic in accordance with the guidance from the FDA, please ask for an alternative because trust me, it's not worth it. I took 3 pills for a UTI and ended up like this. 5 months later, I was on hospice. 9 months after that, I was on palliative care. And it's 4.5 years later, and I'm still totally disabled, doing this from my hospital bed. So trust me, you don't want to end up on this side of the story. So,
Wow,
yeah.
that's a very powerful message you sent, and I hope people will be aware that it is really risky and that it should be it's something that can be avoidable if we spread this message us as a victim. So what should we add now? So the and a very important day is coming, but maybe first we can talk about the code that has been implemented regarding fluoroquinolones.
Yep. So on October 1st,
Yes.
ICD-10 codes, which are medical diagnostic billing codes, were approved for the adverse effects of fluoroquinolone antibiotics. This was quite a project. I joined forces with the Fluoroquinolone Toxicity Study Foundation, patient advocate Audrey Reynolds, Dr. Stefan Pieper, which many people are aware of in this community, presented to the CDC. It was months and months of grueling around-the-clock work to try to get this approved. And I obviously had hoped that it would, but I was thinking there's no way. Like everything that we try to do for fluoroquinolones always gets shot down, but that didn't happen. Every step of the way, we kept getting approved to move forward to the next step. You can make your presentation. Now you can present. And then finally they told us in July 2024 that the codes were approved. And we were like, yes, October. And they said, not this October, next October. I said, oh my God, we're so excited, but we have to wait over a year. So month by month, we've been waiting for these codes, and they finally are available October 1st. These codes are so important to the Phlox community because they do two things. The first thing is that it recognizes and legitimizes our illness. So for all of those doctors that gaslit us and ignored us and said that we couldn't be experiencing these symptoms because of a fluoroquinolone antibiotic, they can't do that anymore. There's an ICD-10 code that says that it does do that, right? So this is so powerful in and of itself. And the other thing that this does is that it provides metrics. So up until this point, if you were floxed, the only way you could get counted in the numbers is that you had to self-report your adverse reaction to MedWatch. And let's be honest, how many people actually self-report? So the FDA comes out and says, oh, it's a 1 to 2% that this happens to. How do they know that? They don't know that. They're relying on people to tell them that they're adversely affected. Your doctor's not going to do it. You have to do it. So now when you go and you get tagged with this ICD-10 code at an emergency room, at a doctor's office, wherever it may be, you are going to be included in metrics. And I guarantee you, whether it's 1 year or 2 years from now, they will know that this is a larger problem than they expected, and it's more than 1 to 2%. I'm positive that that's what's going to happen, because every time I make a post, and I'm sure when you do this podcast, people just all tell their stories. I've been harmed. And you're like, if this is so rare, why do I have 3,000 comments on one post? You know what I mean? It's just, but the proof is in the pudding. So let's go ahead and use those codes and see what happens at the end of the day. So for people that have been following this and may or may not be aware, this project is over and the codes have gone live, but this is not over. This is just the beginning for us. So the first step, and hopefully getting additional codes for like fluoroquinolone associated disability, FQAD. So, but we need metrics first in order to apply for that. The other hope is that now that it's happened for the United States, that other countries will take suit and follow. And I know there's a group in Germany right now that's trying to make that happen over there. So it usually takes one country to start it, and then the rest follow suit. So I'm praying that
Right.
that's the case, because this is a worldwide problem. This is not the United States only.
Yeah.
So these codes, as Dr. Pieper said, he said, for the Phlox community, it's equivalent of man landing on the moon. And that's what it feels like. So we will now be able to go to the doctors and use those codes. And granted, you know, a lot of us here in the United States, I don't know how it is in other countries, we can't really use Western medicine doctors for fluoroquinolone treatments. They have no clue. But at least you can go to those doctors and get any imaging that you need, any blood test that you need. And maybe by some chance, your functional medicine doctor or naturopath can actually bill your insurance. That does happen rarely, but that'll definitely be a help for us too financially because, you know, we pay for everything out of pocket just to survive. So,
Yeah, that's huge. And like you said, it's very common here in France, and I'm sure in the US as well. If you go to see your doctor and said, "Oh, you know, I've reacted really badly to this antibiotic," most of the time, what we have seen is that the doctor is going to tell you, "Oh, you know, but you have maybe fibromyalgia or you have depression and
yep.
whatnot." Now it's not going to be possible thanks to this code. So it's huge. It's huge indeed.
Yeah. The other thing that doctors like to do, and this is important for people watching, is if you say you have an adverse reaction, they mark it as an allergy.
Oh,
And they say, oh, you're allergic to this medication, you shouldn't take it anymore. So to the viewers watching, an adverse reaction and an allergic reaction are two totally different things. You have an allergic reaction, which is, you know, usually imminent and short term. Maybe you have anaphylaxis, you have hives, you have a rash, whatever it may be, you have problems breathing. And then eventually that goes away. Adverse effects are documented by the FDA that are usually longer term and stay with you, like, you know, headaches or neuropathy, which I have, which is terrible, joint pain, muscle pain, vision problems, hearing problems. Like those are adverse reactions. So if you have a doctor that's trying to write it off and say it's just an allergy, you don't need that code, you're going to have to like fight for that and speak up that no, this is an adverse reaction. It's totally different. So,
well, I didn't know that because I would always say I'm allergic to this antibiotic, but you're right, it's like intoxication or even close to poisoning, right? It's very much
right.
different.
And we have to write that we're allergic in our files so we never get it again, but it isn't truly an allergy.
Yeah.
Yeah.
Okay, so let's move on to the very important day that is around the corner now. So
Yeah.
could you perhaps tell us more about it?
Yep. So it's Fluoroquinolone Toxicity Awareness Day. This will be our second annual day. It's hard to say it's very exciting because we are floxed and trying to raise awareness, but last year was so successful and brought so much awareness that I'm excited to see what happens this year. So the goal of Fluoroquinolone Toxicity Awareness Day is for our community to come together in solidarity, right? And that's one thing. And then to raise awareness for the world, what fluoroquinolone toxicity is. And the goal behind it, like the thought was that if we inundate social media on October 22nd and we post our stories, our friends' stories, loved ones, random stories, you don't even know the people, repost other people's posts, like the social media is just flooded with it, that at least one person will see it. This is what we would say, that a person would see at least one post. And we know from last year, people saw way more than one post because people commented and reached out to me and reached out to other people in other countries. So we know that people definitely saw our posts and had lots of questions and stuff like that afterwards. And that's the whole point. So this is worldwide, and there are people from all other countries that are like the what would you call it? The leader of that country for this effort. Like I'm
Right.
obviously the one for the United States, but Sibylle is in Germany. And, you know, we have all these like, I don't know, I hate to say leader, but it is really. And they're really pushing it from their country and getting everybody involved. So I think it's a great way to raise awareness and bring us all together that day. Last year, we had a couple of Zoom calls, and I said, let's see how these Zoom calls go. We had two of them for everyone that was participating in the day and for people that are floxed. And we joined those calls to talk about how we were feeling and how the events of the day were going. And so many people were emotional and crying because it was like a release for them, and that we all got to see each other and that we were joined together. And they were saying, this is the first time we've actually seen each other. We know it's on Zoom, but it's still better than nothing. And we were able to have actual conversations with each other. So that will happen again this year. But I did want to point out that Fluoroquinolone Toxicity Awareness Day, you do not have to be Phlox to participate. We are asking anyone that cares about this cause or want to help to please participate. And there are things that are available to you for this day. We have profile rings that people are putting on their pictures. So people say, what is that ring on your profile? What's Fluoroquinolone Toxicity Awareness Day? We have merchandise you can buy at zero, what do you call that? Zero commission. Like there's no money being made off of this. So it's merchandise that says Fluoroquinolone Toxicity Awareness. We have materials for you to share with your doctors or loved ones. We even have signs that you print them out and you fill them out and you hold it and take a picture that day to say that you've been harmed or your wife's been harmed or whatever. So we have tools to help you participate in that day. So we're looking forward to it. We're looking forward to it and hoping, no, I think it will be even more successful than last year. When I first got Phlox in 2021, there really wasn't that much information. But as each year goes by, it just keeps growing more and more and more, and the awareness is getting more. So this is a very good thing for our community.
That's huge, and I feel like the more we talk about it, and the more it's going to improve the situation. And in any event, you have been on many media in your country, right? So
Yep.
when
Yeah.
was the last time you went on the media, on the TV?
Like 2 days ago.
How did it go?
It went very well. It was for the ICD-10 code. So yeah, it went very well. And whenever those things come out, it's viral. So, you know, it's on their site, the actual local news, and then my site and all the comments. And it's helping us gear up for this day, right? Because now everybody is paying extra attention because I was just in the media. So yeah, people were joking and messaging me saying, you blew up the internet. Look at all the posts. I said, yes, that is the point. This isn't just for me, it's for everybody to raise awareness for our cause. We do this together. Some people may not be able to be in front of the screen like me, but they're still doing things behind the scenes. You don't have to do this to raise awareness. Any little thing that people do helps. So
And like you said before, the fact that even people who are not victims can join this the day, the Fluoroquinolone Toxicity Day. Um, it makes sense when you think about it because anyone can be a victim, right? It can literally
right.
happen to anyone.
Yeah, last year we had people that were advocating for their husband, their wife, some people that family members had passed away. So they were holding their signs with their family members' names. It gets me emotional. But yeah, they were out there representing their family and
Mhm.
friends, which is very nice.
Yeah. And for the people who wonder, maybe they are wondering, so what can you do about it once you are fluxed? Is it for life? Are are you going to be able to recover at some point? So what can maybe explain people about it? Do we have treatments?
Yeah. So unfortunately, I always say once you're floxed and you took the antibiotic, it's kind of too late because this isn't, how do I say it? It's not an exact science, right? It's like if you get cancer and a certain kind of cancer, they know exactly what kind of chemotherapy you're going to get, what kind of treatment you're going to get. But when you're floxed, first of all, most doctors don't even understand what that is. And there is no cure for it. So the doctors that do exist that can help you are usually integrative or functional or naturopathic doctors. And what they're trying to do is use the knowledge that they've gained over their career, and that is by their own trial and error, right? Because there isn't a ton of information on this. And what they're really trying to do is help treat your symptoms. So if you have a lot of neurological symptoms, you go on these supplements, and And as has gone on, the treatments have become more and more radical, right? At first it was just like supplements. Now we're talking about fecal matter transplants and even plasmapheresis now, the blood washing. So these treatments are getting pretty intense because they're seeing results from them. But the thing is, when you're floxed, no floxy is the same. So two people can have the same exact treatment from the same doctor and react totally different. And that is because fluoroquinolone toxicity is essentially mitochondria damage. And once your mitochondria is damaged, the downstream impact that it has on you could be different than the downstream impact it has on somebody else. So this is not like, oh, you're floxed, hurry up and do this protocol. There's things that you need to research, like your genetics and what other things you may have going on in you that you didn't know, heavy metals or viruses, who knows? But it's a very tricky thing to treat. And there are some people that recover fully. There are some people that recover 80, 90%, and there are some people that are still sick many years later. If you get floxed, you will never know which of those camps you will be in. So that's why I say it's not even worth the risk, because to get through that, even in and of itself, is just hell. You don't even want to experience it.
Yeah.
So
Because do you feel like in the box of the antibiotic, like the notice, people are really informed? Because as far as we are concerned in France, the side effects that are mentioned are mostly Achilles tendon pain, but as you well know, it's much more than that. So do you feel like how is it in the US?
it's the same. So this is like it's very frustrating. So first of all, these are all the problems with the labels. First of all, it says for about the Achilles heel, if you're over the age of 65. So if there's a study done by the FDA in 2015 that took people that, researched them and followed them, and they took a fluoroquinolone and they were under 65 and 65. And they found in 2015 that people under 65 suffered just as much from those Achilles heel and tendon ruptures as people over the age of 65. So first of all, that's extremely misleading to say 65 or over. The other thing that they do is they say it's rare. So what do most people do when they see the word rare? We all think we're invincible and rare isn't going to happen to us. So you're like, oh, I don't really need to pay attention to that warning. It's rare. And I'll tell this story because this just goes to show how damaging these labels are to people. Is right now I'm talking to a doctor, MD, MD. So I'm trying to wrap my head around this, who took a fluoroquinolone and she knew about the warnings. She knew. And she went to her coworkers and they told her, yeah, there's the warning, but it's so rare. Like, it's not going to happen to you. And she took a couple of pills and guess what? She's floxed. This is what I mean about saying the word rare. It's such a disservice to people because an actual medical doctor thought they were going to beat it and it wouldn't affect them, but it did. And this is the point. You have no idea where you are going to fall. The only way for you to find out is to take it, and you don't want to do that. The other thing about the warnings is that on no label, does it say black box warning. Nowhere. And I remember on my bottle and on my package, it said, beware of C. diff, which is all antibiotics have that warning. But then it said, beware of minerals and prolonged exposure to sunlight. Okay, and those are like red, no, it was like orange big things on my bottle. Like, really pay attention to those things. And you're like, that's what I'm supposed to be focusing on? How about that this thing's about to disable me after 3 pills? Like, it's just the warnings are poor at best, poor. And I think that goes across the country. And I don't know why they're always focusing on Achilles heel tendonitis, But that one is so old. That came out in 2008. There's like six more black box warnings after that that they're not paying attention to. So,
Yeah. And also, what maybe people want to know is that after you are fluxed, so if it's a life-changing event on so many aspects, and if we only talk about perhaps this one, you can't take like any pain
right.
meds like AINS and all of that, because it can only increase your pain. There are so many things you can do, like even do a MRI, like the products they give you. So you're not even able to take care of yourself properly, right?
Right. So remember that, fluoroquinolone toxicity is mitochondrial damage. So this is going to impact your whole body. It's not like in a week your mitochondria is replaced and you're healthy, right? So that's why we say, and even the doctors that treat flox patients, is that it's kind of like you're floxed for life. Even if you are recovered, there are things that you have to pay attention forever because you don't know if that's going to trigger your mitochondria to make you feel sick again. And so one of the things you mentioned, which is huge, are NSAIDs, non-steroidal, anti-inflammatory, whatever drugs. And that's like ibuprofen, Aleve, Advil, that is for life. And there are many studies online. You can Google it for yourself, fluoroquinolones and NSAIDs, and you will see that it is extremely harmful and disruptive to the central nervous system. So people that generally took those while they were floxed, especially at the beginning, like me, have very severe central nervous system problems. The other thing is steroids. So people don't necessarily think about that. Like you go to a dermatologist and you get a rash. In the United States, usually you get some sort of steroid cream or whatever, or you have some autoimmune disease and it's always a steroid. And steroids really harm people after they've been floxed. You can Google that too. There's tons of literature on this. And, there's other things too, like beware of medication that's fluorinated. If you're taking other medication like diflucan, which is a big one, or Flagyl, like those can be very harmful after you've been floxed, even after you recovered, because remember, it's still lingering out there in your cells and in your mitochondria. And the last thing that you alluded to, which is very important, is imaging because of our muscles, tendons, joints. We're always thinking something ripped. We got to get checked, like check for my pain. Can you see my pain anywhere? And they are extremely damaging even without contrast. So a CAT scan, X-ray, bone density scan, all these things are full of ionized radiation, which damages your mitochondria. So I would say to anyone that's floxed, use these tests extremely sparingly if you absolutely need them and try to spread them apart. There is also talk about MRIs, which are deemed safer, but but a lot of people that have floxed have said their tinnitus has gotten worse. Like they have still had symptoms having an MRI. And we know to date that an ultrasound is the probably safest way to go. So if you could request an ultrasound instead, sometimes that's just totally not possible, but those are things to keep in mind, which are pretty like lifelong things that you need along
Mhm.
you need along your life, like a woman with a mammogram. There's no way I'm doing that. You know what I mean? Like it's stuff that we always have to think about. We will never be free, even though we may be cured.
Even going to the dentist, right? I mean, how many people have flares up after the dentist?
Yep, because of the anesthesia that the local, like the lidocaine. I think there's some epinephrine in the lidocaine, and that really set some people off. And yeah, they feel like they've relapsed or had a setback after that. Yeah.
Yeah, so something as normal as going to the dentist is something you should consider, and it's for you don't
Yeah.
know how long it's going to last. So, and what I found the worst in the recovery is that it's not. and I'm sure many people can relate to that. It's not a linear recovery, right? It's not, okay, I'm 2 years, I feel like I don't have any pain anymore, I'm out of it. But you can eat chicken, and because they feed them with antibiotics, and 3, 4 years later just have a relapse out of nowhere. So
Mhm.
you're never out of it, are you?
No, no. There's, like you said, something so simple as eating a chicken that was treated with a fluoroquinolone. So you literally have to pay attention to every single thing you put into your mouth, on your skin. It's just it's very unfortunate. Yeah.
All right, so how about we talk about the informed consent petition that you are working on?
Yep. So today, when you get prescribed an antibiotic, today when you get prescribed a fluoroquinolone, you just get the prescription and you go fill it. And there are so many failure points in this process, right? The FDA said it should be last resort only. Your doctor prescribed it to you. You take it. You go to the pharmacy. The pharmacy doesn't say anything. The doctor didn't say anything. You take it. Boom, you're floxed. So what we are requesting is that there is informed consent on fluoroquinolone antibiotics. And it makes sense because fluoroquinolone antibiotics have the most adverse reactions of any drug on the market. So it would seem to me like they should have informed consent. And what informed consent does is that means that the doctor, prescriber, whoever it is, nurse practitioner, that your prescriber would have to disclose the warnings, that it's last resort, whatever the warnings are that I've already talked about. And then you would have to sign off and say you understand and you still want to proceed to take it, right? So some people argue that, oh, this is a bad thing because if you get sick, then they can tell you that, well, you signed it. And so you're on your own. That I think that may happen in a small percentage of people, but trust me, if I had informed consent and I saw permanent and disabling side effects, if I saw permanent peripheral neuropathy, I would be thinking for a UTI, no way, no way. I want an alternative. And that is the point, that people will see that and know they should be asking for an alternative, right? And so this petition, this is another thing that's worldwide. Anybody across the world can sign it. And we are almost at 5,000 signatures. We need at least 5,000 to do anything. So I think we have a little 400 and something that we need. So this is also something that we want to push on Fluoroquinolone Toxicity Awareness Day. And I can give you the link to that. I can also give you the link to the materials for Fluoroquinolone Toxicity Awareness Day so people can go print signs or do whatever if they want to participate. But informed consent would be huge. I mean, obviously we want these drugs off the market, but let's be realistic. That's not going to happen anytime soon. So one preventative measure that we can put into place that can help us, in essence, it's a stopgap measure until something more better comes along, is informed consent. So we're hoping that anybody even watching this will go out and sign that, and that if it happens here, it'll happen in other places too. I can tell you, I have been given informed consent on other drugs, and all the two that I was given it for, I refused both. So it did make a difference. Yep.
It does, because you really understand the what is at stake, right? You are like, okay, maybe if I have to sign this, because maybe it's a big deal, maybe it's not something, you know,
Right.
yeah. So it's not something like just a medication and that's it. It's a life-altering antibiotic, and I think it's best you are made aware of that. So, do you see, just the last question maybe, do you see a day happening that it's only going to be prescribed in hospitals, for instance, or,
I hope so. I mean, I think our only chance of this happening is for people to continue to share their stories, right? As I say, shout from the rooftops. Podcasts like yours that get this information out is so important because even if you see that one person that takes the message and you save their life, it makes a difference, right? So I always say, we have a saying here in the United States, the squeaky wheel gets greased. So it's basically like squeak, squeak, squeak. That wheel is so annoying. I'm going to grease it so it goes away. We have to be the squeaky wheel. We are so annoying that they eventually will give us what we want or some sort of compromise to stop our squeaking, right? So that's why I say eventually we become a voice that they can't ignore. And I think between people continuing to share their stories, stuff like informed consent, the ICD-10 codes, the metrics from the ICD-10 codes, like all this has to be put together and be very damaging for them to continue to reduce the use of fluoroquinolones. So every black box warning that came out had like clinical trials or information from the previous black box warning. And then they just kept adding and adding and adding. So that's why all of this is extremely important, because we're here making the case for ourselves and hoping these metrics, not hoping, I know these metrics are going to support us. And I think you'll see over time, it'll be cut down. Maybe it'll get to a point where like maybe doctors have to sign something before they can prescribe fluoroquinolones. Like who knows? But I definitely think there will be a change, not as fast as we want, but I definitely think we're moving in the right direction. And for, people that say there's no hope, nothing ever changes, this week, October 1st, is proof right there in and of itself that there is hope. That they literally just practically move the earth to make that happen. So there is hope. It may not happen as fast as we want it. And honestly, I'm here talking about this, but it's too late for me. All this stuff that I'm doing isn't going to benefit me. I'm already floxed and, disabled, but it's for everybody else. You know what I mean? So these things matter. So.
Not to talk about politics, but do you see Kennedy have any parts in this change? Like maybe he's going to move things?
I don't know. I mean, I saw stuff like he wanted to take fluoride out of the water, and I was like, oh, great. Maybe he'll take it out of the medication. And then people talk so negatively about him. And then people are like, oh, he's going to save us. Oh, we hate him. So it's kind of hard to like, I don't know what's going to happen there. I feel like if it was someone that people were like full-heartedly behind, I'd feel a little bit more hope, but I'm not really sure because at least in the United States, it's definitely like a mixed bag how people feel towards him. And I don't know.
Yeah.
I really don't know.
Yeah. All right, so let's wrap it up with a message of hope. So, like you said, things are moving, and this is the proof. The 1st of October is the proof, and we truly hope that it will, happen in other countries in Europe. But it certainly rushed in, a new process, and we would love to see that happening in other countries. I'll make sure to make all of the links under the description. And thank you so much, Talia, for the support and the voice you give to all of these victims. And I'd love you to conclude this interview. I love people I interview to give the closing message. So we listen
Yeah.
to you.
Yeah. Okay. I actually have a show called This is Floxed, and I have used this since my interview with you. Every episode of my show ends with, please give a message of hope, because I think that's very important because we're here talking about fluoroquinolones and how horrible it is to be floxed, that you do want to leave the viewers with a message that there is hope out there. Your life isn't doomed. And I'm one, I mean, look at me. I I was on hospice. I had my last rites read to me in my living room. I was told I probably had maybe a month because I hadn't eaten. Honestly, I'm still surprised I'm here to this day. I'm still surprised, like I'm here. So you never know what the future can hold, even when you think you know. whether that's the universe or some other higher power that has the plan in place for us, I have no idea. But you know, being floxed and suffering from fluoroquinolone toxicity is a very dark and lonely place to be. And it's hard because most of us, we lose everything, our career, our family, our friends, and people feel like, what is there to keep going? Like, my life's over. But every time you think of that, think of me in this story, and I'm still going. I'm in my hospital bed right now because there's always a reason to keep going. Who in your life could you not live without? Your husband, your kids, a friend, your dog, whatever that may be. There's always some reason for you to hang on, still be here, and fight. So that is always my message of hope, is that until there's nothing left. That's what I always say. You keep going. And I have people that come to me and say, that's it. I'm done. There's nothing left. And it's like, okay, calm down. Let's have a conversation about this. And then you start getting into their story about maybe their family and I say, okay, see, it's not that there's nothing left. You're just very upset right now. So you still have something left. You're still fighting. And every day you wake up, and even if you have that glimmer of hope for 5 seconds when you wake up, hold on to that. Hold on to that. It will get you through. I am not sure what's going to happen to me. I do not think that I will ever fully recover, but I do have hope that something is going to happen and I'm going to turn a corner. And even if I get to 70, 80% from being here, I'll take anything at this point to not have 24/7 care and to do things by myself. So just keep that in mind, that you never know what the future holds, and don't give up until there's nothing left.